60, 70 years old and have a jawbone that's paper thin. And so if you fall down and break your jaw and it's not even as thick as my pinky, the chances of ever fixing it correctly are going to be slim to none. And you're going to have a miserable rest of your life eating baby food.
Mm.
As for this individual, I would obviously, there's a bridge on there now. Obviously, the teeth that are holding the bridge have to be healthy. If they're not, then the bridge is not going to last. It's not a stable environment. So without seeing them, without seeing the x-rays, I can't say for sure, but obviously the gum disease has to be addressed and taken care of, and then make sure that there's no abscesses on the teeth that are anchoring that bridge in place. If all that's healthy, the only other problem they should be looking at would be the bite itself and making sure that it's stable and balanced. So from my standpoint in dentistry, a lot of dentists will look at only the individual tooth and fix that one tooth, and then go on to another tooth and fix that one tooth, go on to another tooth and fix it, and 5 years down the road they don't even realize but they've caused a massive bite problem. I always try to look at the big picture first, where I want to get to, what I want to accomplish, and then address it that way, and how do I get there. And there's three main areas to look at. The gums have to be healthy. That's the foundation to everything. If they're not, nothing else is going to last. Then I look at the bite. If the bite is stable and then the forces are being put on the teeth in the right position, everything's great. If we're missing teeth, we're now putting force on teeth on less teeth, trying to take more force, and so you're going to have a cascading effect of losing teeth. So we need that stable bite. And then last but not least is when I look at the individual teeth, the silver fillings, cavities, and stuff of that nature.
Does insurance cover removal?
Yes, in general it does. If you have a silver filling in there and you want to take it out, it will pay for it. Most of them at this point in time will pay for the silver filling fee of it, so you're looking at $30, $40 to take one out, probably out of pocket. Now that the FDA has come out with their new ruling, it's going to be interesting to see what insurance companies do. They may now be forced to pay for the full fee of removing the silver filling to a composite.
Okay. Jump in, Sherry, whenever you feel like. Is it advisable to supplement with high levels of vitamin C for those with fillings that have not been taken out?
Well, I mean, I wouldn't say that probably staying on massive doses of vitamin C over long periods of time is going to be good. That's probably a question Dr. Dave might be able to answer better than I could. Our recommendation is the higher level of vitamin C when the fillings are being removed to help bind to any mercury that we caused. That when we take it out, that spike we're talking about, we want that mercury to be bound to that vitamin C and excreted through the body as fast as it can be.
Okay, great.
Dr. Luna, I'm not sure if you've addressed this already. A couple of questions came in regarding fluoride in toothpaste. Is that something that is helpful or that you recommend or that causes any problems?
Yeah, right now I'm torn. Again, as I try to remove any harmful substances that I can, such as mercury, the question comes up about fluoride all the time, and from a dental standpoint, the benefits of fluoride are obvious. When we go into rural areas and help underprivileged people, you can see which counties do not have fluoridated water. The caries rate or cavities are rampant throughout the teeth, and when you get to an area where the water is fluoridated, you don't have many cavities anymore. Looking at statistics, since water started getting fluoridated, cavities have dramatically decreased in the general public. So from a dental standpoint, fluoride is a fantastic thing. Now, that being said, if a small child eats a whole tube of toothpaste, they could die from fluoride poisoning. And so I'm kind of torn and need to do more research myself on the effects that fluoride can have on the rest of the body.
Is there research being done about other substitutes for fluoride that would be as effective but that wouldn't have any harmful effects?
Well, right now there's toothpaste that are coming out. It's probably the wave of the future that contain products that are supposed to help remineralize the tooth. And what's happening to a tooth all day long is it's being attacked by acids. As we drink sodas, we eat food, and everything's broken down to these products. They can get broken down into acid, and that attacks the tooth. And the tooth is actually trying to remineralize throughout the day itself. We're seeing toothpaste now coming out that have products in them to help promote remineralization of the tooth and to balance out the acidic environment in the mouth. If we find that perfect product, then it could be a thing where they say, hey, we don't need fluoride anymore in the toothpaste. We're getting it in our water for development standpoint, that's fine. Now we got the toothpaste out here that are remineralizing the tooth, so we don't need it in the toothpaste. I could see that happening down the road, but we're not there yet.
Okay. In your bio, it mentioned that you treat people with snoring. Could you talk about that just a little bit, some of the treatments that you do for people who snore?
Sure. As we were talking about clenching and grinding of teeth, if you remember some of the pictures, we noticed that people's teeth were worn down. So they might be half the length that normally they were born with. So all this clenching and grinding wears our teeth down. It's my belief and philosophy that as the teeth wear down, it only makes sense, the top teeth are kind of angled. As our teeth wear down, our bottom jaw doesn't go straight up. It kind of goes up and back. And when it moves back, it is going to cause the tongue to go backwards. And at that point in time, it's going to close off the airway. And so you've got treatments now typically for snoring and sleep apnea, and really talking about sleep apnea here, where you stop breathing in your sleep, like the CPAP machine, which is basically is a mask trying to force oxygen into your blood system to keep your oxygen levels high. Mm-hmm. And then other procedures that have been done have included surgery, cutting off part of the soft palate, tonsils, and stuff of this nature in the upper airway to try to open it up so you can breathe better. The appliances that we make are based on CPR principles. So if somebody knows anything about CPR, the first things you do, the ABCs, is establish airway. You do a head tilt, chin lift to open up the airway so you can breathe in to give them respirations. The appliances we have, that's all it's based on. It snaps on the top teeth and the bottom teeth, but it pulls the bottom jaw forward, and not tremendous amount, but it pulls it forward, so when it comes forward, the tongue comes forward, and your airway opens up, and you're able to breathe on your own. And it alleviates your snoring and your sleep apnea. The people we put on it, they love it. They're so happy to get off a CPAP machine and a mask that's, blowing air down their throat all night long, and they can't roll over and have all the problems with it.
Does insurance cover them?
We're having a hard time with that. Yeah. So they want to pay for the CPAP, and if you can show us more research, come in and present it to the insurance companies. Blue Cross is real big in our state. They'll consider it. We are now talking to more sleep clinics and getting them to refer to us, and we're seeing better results because of that.
Okay. A quick question on the amalgam removals. You talked about how much it would be with insurance. How about without insurance?
Depends on the region of the country. I happen to live in an area that you have the cheapest prices available.
Oh, really?
But, you go to the West Coast and you go to the Northeast, you're going to be looking at the most expensive prices. Okay. They can range anywhere. A composite filling, I would say, will range anywhere from $100 to $500, depending on the dentist and where you live.
Got it. Okay. Someone's asking a question about bacteria. She says, since bacteria are such a major negative factor in the mouth, have you read or researched the correlation between the bacteria in the intestinal tract and the bacteria in the mouth? And what I have learned in the recent years, I personally feel that the right ratio of friendly to unfriendly is 85% to 15% in the gut. Is there a correlation with the mouth? Is there a relationship there? Are there any good bacteria in the mouth, for instance?
Yeah, and there is. there is. It would be hard to say a true correlation. Most of the issues that we see is the bacteria that's adhering to the calculus, and that's a visible product that you can see. Now, as the previous slide, you can see it on the teeth itself. So that's the main problem we have. Is there bacteria that's sitting in the pockets around the teeth that's invisible? Yes, there is. Could I give a true percentage relation-wise? No, I could not. But when it comes to most issues with periodontal disease, it is the bacteria that is adhering to that calculus. That if we remove it, you're going to remove, I'd say 90% of all the quote-unquote bad bacteria in the mouth.
Okay. Someone says she went to lvilive.com, but it does not allow you to click on Find LVI Dentist. Any other suggestions?
I might give them a call. There should be a phone number there and ask them that. They've gotten a little finicky lately. If you're not going out there and taking their courses still, they have a tendency to sometimes bump you from their referral lists. But I know that we still get referrals from them, so you might want to call their 1-800 number and just talk to them personally and tell them where you live, and they should be able to give you a dentist in the area.
Great.
Dr. Luna, here's an interesting one. Is there any danger to you, the dentist, or the assistants long-term, removing all of those amalgam fillings?